Hello, welcome to the StellaLife Innovator series. I'm Liz Lundry, and today I have the pleasure of speaking with Melissa A Obrotka, a hygienist with over 25 years of experience in the dental field and concentrated clinical experience with dental implant patients. Melissa's core objectives for patient care are focused on a holistic approach to dental prevention, disease remission, and therapies that encompass total body health and wellness. She is a hygiene motivator, educator, podcast host, and influencer, and she's elevated clinical education by instructing students on the oral microbiome, biofilm disruption, and introduced Guided Biofilm Therapy, or GBT, which we're going to be discussing today. So having achieved so much recognition for her clinical expertise, Melissa is the U.S. GBT Education Manager for EMS Dental. Welcome, Melissa. Thank you so much for joining us today.
Thank you, Liz, so much for having me. It's such an honor to be able to share some time with you and talk about my love for GBT.
Oh, well, thank you so much. So let us talk about GBT. So what exactly is Guided Biofilm Therapy?
That's a great question. So guided biofilm therapy, or GBT as we refer to it for short, it's a systematic and predictable solution for biofilm management within the dental hygiene appointment. So basically, Liz, I'm going to turn it around and ask you a question. Tell me some of the things that you've experienced as a dental hygienist, and also from your work with other clinicians of like, what are the things that hygienists complain about within our profession, like doing our daily job, our clinical care? What are the feedback that you hear from most clinicians?
Right. That's a great question. Having been a hygienist for over 40 years and seeing like technology develop, because back when I started, we didn't wear gloves or masks. Ultrasonics were only used above the gum line. We didn't have the thin, tips. So it was a whole different era. But I think universally throughout the years, as not only a clinician, but as a trainer and educator myself, I think time is one of the key complaints or concerns that hygienists have, because they're trying to do so much in that appointment that they have, whether it's 45, 50 minutes or a full hour, and trying to, a lot of times, as I've learned as a trainer, trying to do too much clinically that they can't really do within that time.
Yeah, absolutely. So what I found when I integrated GBT into my practice was that it really, once I got comfortable with it and I understood the protocol and I trusted the process and I followed it, I really was able to kind of eliminate a lot of these barriers that we have every day in our clinical day-to-day duties. Time being one of those issues. Is that exactly what you said? There's so much to do and not enough time to do it in. And every year as a clinician, I observed, we learned more, and when you know better, you do better. And the more you learn, the more responsibilities or assessments got added into that appointment. But the time of how much, time you had to work with your patient really didn't change. We were just kind of stretched with doing more. So when I integrated GBT, I realized that this technology is so efficient and so helpful that I gain time within my appointment time. So I noticed about anywhere from like 10 to 15 minutes that I would save during the debridement portion of my appointment. So it's much more efficient. But what's amazing about GBT is that first, let's break down what the G is, the guided part of guided biofilm therapy. So after we do our assessments, we're going to figure out what our patient's needs are. So if you think about, when we assess our patients, it's so important to do our probing every time we treat them, because if we don't know what's going on, how do we know where to go? So the guide then becomes step 2, which is our disclosing solution. And I'll be honest, when I first learned about GBT, I was like, I don't have time to do another step. Like, what do you mean? I haven't touched disclosing solutions since hygiene school. Why am I going to bring that out now? I hated it then, but I just succumbed to trusting the process. And the day I did it, it was literally game changing. Every patient that I treated, there was no barrier to the treatment that I was recommending. There was like instant acceptance, because the mind can't know what the eye can't see. And when I made biofilm visible, they understood what was going on. They were like, oh my gosh, I'm doing all the things, but clearly I'm not doing a good enough job. Or, wow, now I really understand why I need to brush, use interdental brushes between my teeth, or why I need to clean between my teeth. So bringing that mirror up after disclosing and having those knee to knee, eye to eye conversations with my patients changed everything. And my perio recommendations, no longer was it, oh no, I can't do that, my insurance isn't going to pay for it. It was like, get me in the chair, get me, when can I come back? Let's get this done. So that was such an incredible. Guided biofilm therapy really is step 2, which is disclosing. And so it's going to help you with your patient acceptance, but it also in turn makes you a better clinician. And you have that instant visual feedback as you're doing your debridement. When you work with your airflow, you're watching everything disappear. You're just watching the biofilm vanish. And it gives you that instant feedback, that gratification that, wow, I'm really doing a good job. I know I'm working efficiently. And we're not over instrumenting either, because we see it all disappearing. So we gain that time, those magical minutes, as Karen Davis always likes to say. We gain those minutes because we don't need to keep working and wondering, did I get it all off? We see, boom, it's gone. So, and then the B is biofilm. So we really need to, as a culture in dental hygiene, shift our mindset from focusing so much on calculus removal to biofilm management. And the reason why, and I love sharing this with my students, is that yes, we need to get you proficient at removing calculus. It's not healthy for our bodies to have that deposit sitting between the gum and the tooth or the implant, what have you. But it's dead, it's petrified, right? Biofilm around it is alive and virulent. So we really need to switch and shift our mindset to that. And if we manage biofilm, guess what happens? Less calculus. So it makes our jobs easier as well. And when we don't have to spend so much time using power scalers to remove calculus and then hand scaling after, it's less fatigue on the operator. It's a better experience on the patient. And we're being less invasive because we're not removing and damaging so much tooth structure or tissue in the process using these instruments.
Yeah.
So, and it's therapeutic. So that's what the T, therapy, it's a systematic 8-step protocol that is therapeutic for our patients. It changes the patient experience and it allows us to be minimally invasive while being maximally preventative. So that's GBT in a nutshell.
That's great. I had my own feelings about disclosing solution. Like when I was in hygiene school, I bet I would never use it because it was always, such a mess and all that. But I've learned through my own experience, not only having worked with EMS, the ultrasonics, the air polisher, that technology, and the benefits of disclosing, but also as a patient. I alternate with a periodontist because I also have gum disease, like many of us do. And having actually a perio maintenance appointment by my incredible hygienist in my periodontal practice in San Francisco, and SF Perio. And the cleaning I had there, the maintenance, was using GBT because they do have this technology there. And she was disclosing not once, but a couple of times through the procedure. And honestly, with minimal instrumentation on the root surfaces, because as you say, we're damaging those root surfaces with curettes and if we're using them repeatedly, ongoing damage. But anyway, my experience was it was the best cleaning I ever had, the most comfortable and the smoothest. And I have a lot of issues with fixed retainers and other areas that are very challenging for clinicians, which I would hate as a clinician to have to deal with myself. So it was just like a whole different experience. So as a clinician and as a patient, I'm totally behind it. So can you tell us a bit about the EMS system and why it's so effective and efficient?
Sure, absolutely. So we provide our patients with guided biofilm therapy utilizing specific technology, which is the airflow prophylaxis master. And this technology is really designed with the hygienist in mind because it's everything that we need in one device. We have 2 sides of the technology. One is our airflow side, and there's 2 hand pieces that work on that side. We have our Airflow Max hand piece that allows us for supragingival biofilm management. But the technology is so powerful that it will actually reach up to 4 millimeters subgingivally from a supragingival approach. And then on the same side of that technology, we have an additional handpiece. It's called our PerioFlow handpiece. And that handpiece has a disposable plastic flexible nozzle that can actually go into 5mm pockets and disrupt that aggressive subgingival biofilm that we know is pathogenic and breaking down the epithelial lining and getting into our patient's bloodstream. So it provides us with an elevated way to manage periodontal disease and get those patients into remission. And then on the other side of the technology, we have our Piezon technology, and that's our calculus removing tool that we have. And what's amazing about the GBT protocol too, is that by the time we get to that part of the technology, we've already been able to visualize the biofilm being removed with our airflow and possibly perioflow if needed. And then we don't have to instrument 360 degrees around every single tooth by the time we get to the Piezon technology. And with our PS no pain instrument, which is suitable for about 95% of our cases, we have great ability to adapt and access, and we're only utilizing that now where we've palpated subgingival calculus. So that what we can now see better because biofilm's been removed, but we've already felt that on our assessment because we're assessing comprehensively every single patient because it affords us the time to do that. We've minimized the amount of time we're using debriding within our appointment. So once we've finished our step 1 assessment, 2 disclosing, 3 doing our oral hygiene instructions and motivating our patients before we even start debriding, so they see the biofilm present, and when we do OHI, they can actually see it being removed with the proper technique and application. Then we airflow, perioflow if needed, Piezon to remove our remaining calculus. And then what most clinicians observe is that they really don't have to hand scale very much because we've done such a comprehensive job with our technology. So I usually recommend using a universal curette and just doing a really light exploratory stroke to more so check yourself. And then if you feel any fine, small deposits, you have the instrument in your hand to remove that, but we're not activating that stroke around every surface of every tooth. So that again allows us to be minimally invasive, maximally preventative, and that all enhances that patient experience. So that would be a great time to redisclose if you want to check your work and make sure that you've comprehensively eliminated everything. But I've always kind of relied on that, again, that visual, example, because I saw the disclosing solution, I saw it disappear. So I didn't always feel the need, unless it was like a complicated case, maybe FERCA invasion or implant case, that I would go back and do that. And then we set up our patients' recare, and patients, because the whole experience is so much more improved. They often say it's like a spa treatment rather than what they're used to as a traditional cleaning appointment. Yeah. That they're likely to set that appointment up right then and there. Often when you're making a suggestion for a 3 or 4 month recare maintenance visit, they're more likely to do that despite what their insurance coverage is. So it really helps educate and engage the patient in the process. And because it's a non-invasive and it's a pleasant experience, they're more likely to do it. So there's a lot of, I get questions often like, what's the return on investment with this technology? And there's a lot in just the productivity of the hygiene department. The hygienist is the one person in the entire practice that has the ability to impact 2 revenue streams: their own production and what they help get into the restorative chair. So GBT really allows us the time to do that education, take those IOPs, show patients what's going on in their mouths, and kind of like set the doc up for the assist so they can slam dunk when they come in for the examination part. So GBT is so beneficial within the hygiene realm, just saving us time, less impactful on our bodies, but more comprehensive in the care we provide. So what a lot of clinicians will observe is my patients are getting healthier. And why do we get like burnt out and frustrated? Because we do the same thing over and over again, and we don't always see a great result. Right. So here, now we have technology that allows us to provide a better experience for the patient, a better result for the patient, and it's less burdensome on our bodies. So it's literally like a win-win-win. People describe it all the time as a game changer. And it is. It's changed me as a clinician. So many of my colleagues have the same experience and same stories. And it's literally the Tesla of dental hygiene.
Yeah, and it's great because the patients are more comfortable, and because you are more efficient with the time, you have the time to talk about the restorative, and they really trust the hygienist, and they respond very well to having that conversation with the hygienist before the doctor comes in. So as you said, you're setting that stage. And as a trainer myself, I think that the restorative is something that we really need to always make sure we discuss, because until we get rid of those failing restorations, we are not completing our battle against the biofilm, because those are biofilm playgrounds. They are really also, you've seen that where you've done therapy on patients and they heal everywhere except the place where they have an old crown that the doctor
Overhang, yeah,
replaced for a long time. So
right.
putting those two together and having that time is a great benefit, not only to the practice, but really to that patient, so they can live healthier and live better and live longer because of those pathogens that we're dealing with. So with this system, you're able to be effective with implants as well, because we're using erythritol powder, which is not going to cause any damage to any types of implants. So I know when people are used to air polishers, it's a whole different approach and a whole different technology, which is kinder and gentler and actually does kill biofilm. So I think that's incredible. So as a company, when an office transitions to this technology, do you provide help with implementation and training the clinic?
Yes, that's a great question. And it's definitely a critical piece in the implementation of GBT to be successful. Whenever you do something new, and GBT kind of goes against the grain of the foundation of how we're taught to provide hygiene. So it's hard. I know from my own experience, I really resisted a lot of it in the beginning, just because it was so foreign from my foundation.
Mhm.
So why training is so critical is just to help assist with that process. And all of our US GBT SDA trainers are clinicians themselves that are treating patients every day with GBT, and they're able to really share with you those pearls of knowledge from their own personal experience. But yeah, we actually will send a trainer to your practice. It's a 6-hour full day training, no patients, just for the entire team. So everybody can get calibrated on what GBT is and the messaging and the integration. And we spend a couple hours on theory, we spend some time going over the device and maintenance, and then the rest of the time we get the team in the chair and the hygienists are doing GBT for the first time on their teammates, and they get to experience it from a patient perspective. They get that feedback of what's different about it. And we just want to get those hygienists really comfortable with the technology and the application before we leave them to do it daily with their patients.
And it's great because the whole team is there, and
Yes.
patients ask everybody questions, and the doctor and everybody needs to be very comfortable with this. So yeah, I am so happy that we had this opportunity to share this information with our clinicians all over the US. So I want to thank you for your time today, Melissa, and also thank you all of you who've joined us today. I really urge you to look into this. This is incredible for the patients and the clinicians, and so many advantages, and you can really take care of so many of their patients' needs in total comfort. So it's a great practice builder in that sense. So again, thank you everybody for joining us. Please join us next time on the StellaLife Innovators series. Thank you again, Melissa.
Thanks, Liz, for having me.
Okay. Bye, everybody.